Triad Hydrophilic Wound Dressing is an extremely versatile wound care dressing. The zinc oxide-based paste naturally debrides necrotic tissue through autolysis. In addition, Triad absorbs light to moderate amounts of exudate, and it protects the peri-wound edges from maceration. Indications for Triad include the management of pressure ulcers, partial and full thickness wounds such as venous stasis ulcers, and first and second degree burns. Triad gently debrides devitalized or necrotic tissue through autolysis. Autolytic debridement is a highly selective, painless process where the body's own enzymes break down only necrotic tissue, leaving healthy tissue intact. Triad is made of a unique preservative-free blend of zinc oxide, petrolatum, dimethicone, and CMC, or carboxymethylcellulose. CMC absorbs moisture. This allows Triad to adhere to both intact and wet, eroded, or broken skin. It's an ideal alternative for difficult-to-dress, light to moderately exuding wounds, such as those near the gluteal cleft. Triad gives you a natural, painless way to debride necrotic tissue through autolysis, an alternative for difficult-to-dress wounds with up to a 7-day wear time, a dressing that can be safely used on peri-wound edges, a dressing suitable to use on neonates, and a cost-effective solution with documented results. The patient in this case study had 2 pressure ulcers, both covered with thick black eschar. Autolytic debridement was initiated using Triad. A secondary dressing, biotin foam, was used to absorb the liquefied necrotic tissue. Dressings were initially changed 3 times a week and then decreased to twice a week. After 1 week, the smaller wound was free of necrotic tissue, and after 3 weeks, the larger wound was completely debrided. Prior to applying Triad, rinse the wound with C-Cleanse Wound Cleanser. Gently dry the peri-wound area. For autolytic debridement, apply a layer of Triad over the necrotic tissue and the peri-wound area. Apply Triad no thicker than the thickness of a dime. To help absorb liquefied necrotic tissue, cover Triad with an absorbent secondary dressing, such as biotin foam. The amount of wound exudate will dictate the frequency of dressing changes. Triad should be changed at least every 5 to 7 days. Once the wound has been debrided, Triad can still be used to promote a moist wound environment. For shallow wounds, apply a layer of Triad directly on the wound. Apply no thicker than the thickness of a dime. Triad easily adheres to the moist wound bed. Unlike hydrogels or other wound pastes, when Triad is applied to the peri-wound area, it will not cause peri-wound maceration. Cover Triad with a secondary dressing such as biotin foam or Comfeel Plus hydrocolloid. The amount of wound exudate will dictate the frequency of dressing changes. Triad should be changed at least every 5 to 7 days. For deep wounds, including those with undermining or tunneling, impregnate a 4x4 gauze or piece of ribbon gauze with Triad. Loosely pack the impregnated gauze dressing into the wound and in areas of undermining or tunneling. Place the impregnated gauze dressing in such a way that it can be easily removed from the wound. Cover with a secondary dressing, such as biotin foam. Impregnated gauze dressings are usually changed every 24 hours or per existing wound protocols. To remove, carefully unsecure the secondary dressing and, if necessary, remove the impregnated gauze dressing. Spray the wound and peri-wound area with C-Cleanse Wound Cleanser. Gently wipe the Triad off with a clean piece of gauze. Repeat this process if necessary. Triad Hydrophilic Wound Dressing is a zinc oxide-based paste that naturally debrides necrotic tissue, absorbs light to moderate amounts of exudate, and protects the peri-wound edges from maceration.